guys review. Can you guys tell me how you feel about blood flow, like on a scale of 1 through 5? Can you do, if I gave you like a pop quiz, and I did not give you a word bank? Wait, are we at a 4 now?
I choked on pop.
3?
Fact.
So what do you have? Your valves, your chambers, and the vessels, right? So we're at 4 or 5. That's pretty confident. I'm gonna check we're gonna do a quick review so I can check for understanding before you go in there. Play a heart sound for you, that's normal, okay? Maybe that will give you guys some more ideas of what you want to hear. And okay. Was it clear and consistent? Mm-hmm. Did you hear both sounds? Mm-hmm. Now I'm going to show you guys one that has some abnormality, okay? Get your faces. What's going on?
Is the blood pooling back up?
Sounds like it's
It sounds like fire.
Any suggestions?
That sounded like an ultrasound.
It
does sound like an ultrasound.
Isaac? What was a weird sound you heard that wasn't normal the first time?
Like gurgle.
It was almost like staticky.
Like flush.
Okay. So, my best friend when I was in high school had heart surgery as a baby, okay? And she had a heart surgery because there was again, the doctor heard a strange sound, a murmur, right? She was having trouble, you'll see different sets of symptoms. Hers was that she was having trouble breathing. And within 1 week of her birth, they had to do a surgery to fix a hole like right here. In what's this area called? Okay, so she had a defect here. Can anybody predict for me what a defect right here, exactly a hole right here would do? So I'm gonna let you guys talk and think, pair, share for a couple of like 30 seconds or so that we can come up with a quick solution. I'm not looking it up, just think about it. What if there was a hole right there? What would happen?
And then all the blood would go back. You raised your hand.
Okay, what do you think, Josh?
I said it'd like mess up the flow and the blood would mix, like the deoxygenated and the oxygenated blood.
So the blood coming this way would mix with the blood that's going that way? Here's a clue, okay? Thinking about blood flow right now. Would this blood flow through the hole that way into this ventricle, into the left? Or do you think that the left ventricle would push the blood into the right?
The left to the right, because the left is stronger.
Why do you think left pushing it to the right? Why would it push it?
Because it's the strongest valve.
This is the big muscular ventricle.
Yeah.
Why is it so big?
Because it goes to the body. That's
It
go
has to get
everywhere.
into the aorta. It's going to want to push the blood this way. Is that a problem?
Yeah.
What's the biggest issue?
It's they're
Where is oxygenated blood supposed to go?
So the body.
But it's not. It's going to the lungs actually, because it's going back this way and it's getting pushed up to the lungs. That's a huge defect.
Well, what happens when oxygenated blood goes to the lungs?
Double oxygenated.
Yeah, that's what I'm saying. It's just like more oxygen, but what?
You get what did I say was a symptom of my best friend in high school?
Breathing issues.
She couldn't breathe,
She was coughing.
so she was coughing, extra blood in the lungs, okay, and a whole other set of it. Look, you guys are already on your way to solving these problems without even going in the lab. Review that research so that when you get started, everybody knows what a congenital heart defect is.
Okay. A congenital heart defect happens during this first 8 weeks of the baby's development.
Okay, tomorrow I'll try
And no, in the baby's into the baby's development.
This would be a congenital defect. What exactly is a congenital? What does that mean?
It happens in the first 8 weeks of birth.
So basically, this defect is happening to who?
Baby.
This is happening to the fetus while it's still developing. The next question: how common are congenital heart defects? Let me ask. Hold on one second. Let me go ahead and ask Richard. How common are they?
What I put as the most common is birth defects.
What?
They're the most common in birth defects.
They're the most common in birth defects. How common exactly? Does anybody know how often they occur?
0.009%.
And they said about 9 occur in every.
Thousand.
So think about it at the scale here in our high school. Do you know how many kids we have here?
2,000.
2,000. So we're looking at how many? How many possible?
18.
And that is just within our community. You guys think about it. Just within our community, you have a possibility of 18 heart defects. In our high school, carefully open the document up that guides you through your diagnosis, step by step. Okay? What does step 1 say?
Review patient history.
Review patient history. Now scroll down to your table number and read about your patient real quick. It should take just a couple seconds. Okay, let's just to get an idea that every group has a different defect. Let's have Naomi here. Can you guys share with the class what's wrong with your person, your patient? Yeah.
She often sweats while feeding. She has had one respiratory infection that may be caused by this heart defect.
Okay, she's got a respiratory infection. She's having trouble feeding. She's having shortness of breath, right? How old is she again? 1 month. What about this one right here? Can you guys share?
So an 8-year-old female child is experiencing shortness of breath, especially when exercising. She feels excessive fatigue. She also complains of heart palpitations during a checkup. The pediatrician noticed skipped heartbeats. There was a definite heart murmur and swooshing sound that could be heard throughout the stethoscope.
We heard a swishing sound. Did you guys hear a swishing sound in the heartbeat that we played in the class before?
Yeah.
So she's only 8 years old. Okay, she's got trouble at PE. She's struggling. She's feeling very fatigued. Imagine why you would feel fatigued if your heart's not working properly. So now you guys have read your different defects. Let's take a look at the defect. I want you guys to open up the person who has the gloves on. Okay?
Josh.
Open up the heart that was given to you. You guys will see a pin where the defect is supposed to be. If I were you right now,
There's 2.
I would try to use either the red or the blue pipe cleaners to try to work its way through the defect and see where you get stuck. Okay?
What's that? Those are the atrium. The pulmonary artery? No. They're the that's the back, right?
Oh! Okay, piece of the heart is falling off.
Yeah, and having trouble pulling it in. So I'm guessing it's
No, I'm there, man. Trouble
All right. If you think you have an idea of where the defect might be, listen. There's a piece of paper the piece of paper you're taking notes on, there is a CER document on your paper. This is where you can take rough drafts of notes. Under evidence, if you think you have any idea of where the pin is indicating the defect, write down what you find under evidence. That's your first piece of evidence, okay? So, table 1 finds that the pin is on the bicuspid valve. They're going to put that down as one piece of evidence, okay? Now, the second piece of evidence. I want you guys to scroll over and listen to the normal heart sound and the defective heart sound that your heart has. This is where you guys might need your headphones. So listen to the defect.
I don't think anybody has headphones like the 3.5 millimeters. I get pokes and I get this side.
I found these like I brought them for testing.
Alright, so what valve is this getting stuck at?
The aortic valve.
Seems to be. Let's write your evidence. Here. You guys got it. Good job. But you're not sure what the defect is yet. You're still studying that.
On this part is yes.
That's the question.
Oh.
Is it? No.
Is it broken so it's not showing up on here? So it's because it's not.
Is this just from like this view? Like
This is an ankle of it.
So because there's no aortic valve on here.
If you know which valve it
That
is,
just says aortic.
if you know which valve is the problem, go straight to that defect and listen to it.
Where is it?
Compare it to yours.
Atrial septum. Just like the aortic valve is.
Did you guys find it? Yeah. Oh, good job, you guys.
So do we fill
That's
it out
awesome.
on here or do we fill it out on here?
Okay, so
So we make our claim, right, as to what we think it is, and then why we think it's that, and then we transfer to here as our final.
what I'll do is I'll explain that.
Oh,
I'll
okay.
explain this. Let's get to fun. So in your claim, you tell me the defect name, and you tell me the answer to how it affects blood flow. What does it do? Does it mix up deoxygenated blood from here to here and explain it? Under evidence, what did we do right now to guide you to answering it? If you right away knew where the pin on your heart was pointing to, let's say it was the aortic valve, you need to explain that. If your EKG is showing the valve and it appears to be broken, you need to put that on here. Are there some symptoms that patient has that might lead you to think that they have this condition? Put that all under evidence. And guys, most importantly, let's read this one. You are going to, there's plenty of diagrams online for your defect. I want that modeled here under evidence. Yeah. What do you mean?
Keep going in that space.
This needs to be on here, like in 5 more minutes.
Oh, so it's no, you just start here.
Because right, if you're getting a whole shortness of breath right away, something is. Okay, I think that many of you are now ready to do research. You guys have your evidences listed. Blood flow affecting the patient and causing them to be at risk. Okay? So when you look over at the symptoms again and the person is experiencing shortness of breath, look back at which way the blood was flowing. Why would they be experiencing shortness of breath? And prove it to me under reasoning. You may have to, anywhere you guys had to do research, whether it was the diagram, whether it was any parts of this, make sure you save those links because you guys are going to include your citations for this CER. Leave them both unless it affects you.
And then go through into the pulmonary or into the right atrium and the right ventricle.
So your pipe cleaner that's going to be the most, I guess, important is going to be this one returning.
Because the blood is coming back anywhere it's not supposed to.
So you possibly want to show it. I'll let you guys decide. Come back. So, quick peer review, okay? What I want is for you to send a couple of your members across the tables and walk over there and give them one comment on something that is working really well in their depiction of their defect, and one suggestion for what you would like to see in their CER, okay? And that way, the kids that are sitting there can take quick notes on what is one thing going well and what is one improvement. We'll just do a real quick peer review to help guide each other.
Is it the same or is this?
Alright. But I do want that these defects are explained to each other, right? That there is some cross-teaching going on between groups. So, it doesn't have to be long, but when the group explains their defect, give the name of the defect here on your note paper, its effect to blood flow, and the effect to the patient, the risk to the patient. Just have at least a couple of people from your groups take notes, especially if in case you're still working, have a couple of people from your group take notes on other groups' defects.
For our patient, we have a 16-year-old male experienced a stroke. This happened shortly after exercise. Previously, he complained about shortness of breath, fatigue, and frequent swelling of the legs, feet, and abdomen. So our claim was that the 16-year-old male has ASD atrial septal defect, which it causes high blood pressure, which increases the risk for stroke, like the male had a stroke. And then blood flow from the left atrium, which is oxygenated, flows into the right atrium, which is deoxygenated, which kind of mixes the blood, which is not good for him.
So the evidence, obviously he had shortness of breath, fatigue, stroke, swelling the legs, feet, and abdomen, which shows that the blood is being affected to the body, not the brain. Stroke after exercise, and also the pins in the ECG helped us find what our defect was. And our reasoning is he had a stroke, which is one of the symptoms of ASD. The fatigue we believed was caused by high blood pressure. He previously showed no symptoms, which is a thing that is common for ASD. Usually there's no symptoms, especially in early childhood. And obviously he wasn't till he was 16 years old. The heartbeat had a whooshing sound, but like fluid was going in the wrong place. And then again, swelling showed that the body was affected, not the brain.
So what happened with the heart?
So the heart, there's a hole in between right here, between the left and the right atrium. So in the left atrium, it goes into the right atrium, and then the blood keeps recycling.
So in this case, in this diagram, you're showing that the blood is going from the left to the right atrium.
Yes.
Okay, guys, why would it go from left to right and not right to left again?
Because the left.
The power stroke of the left side is stronger, right? You guys give them a hand, they did such a great job. So you couldn't ask for anything more beautiful. It's like perfect.
Initial claim was that the baby has ventricular septal defect because there was a hole and the baby also had a hard time breathing.
After viewing all the different types of congenital defects, can you guys come up with 3 different things you found in common with all of those defects? As a group, write down 3 things you know. Sarah, what's one thing you found in common among all the different defects we studied?
They all had a lack of blood flow.
They all had a lack of blood flow to different places. Maritza, where's Maritza? Anything else you found in common? Lots of patients were feeling fatigue. Hey, why would you feel fatigue is one of the causes of lack of blood flow? Yes, lots of different answers. Can I have a volunteer, a third person volunteer, one more commonality so we can all discuss? Yes.
That a lot of heart failure affected the respiratory system.
Why is that such a big deal?
Because there's a lot of blood going to the lungs.
And blood coming from the lungs. So we had respiratory failure and aches in certain patients.
Yes.
If I gave you a quiz on Thursday on heart defects, are we now closer to a 5?
Yeah, we're like
Let me
that.
see your hands. Where are we?
4.5.
Someone went 1 to 5? 4.5? Just need a little step.